Hi everyone. Today we'll be going over the Outbreak at Greenfield Farms Case Study 2 assignment. To begin, let's get a little bit of background information. So today we'll be discussing Greenfield Farms, which is a large mixed-use agriculture facility that produces dairy, poultry, and vegetables. The farm is located near a semi-urban area where residential neighbors border the farmland. The farm operates a small dairy processing plant and supplies milk and poultry to local grocery stores and schools. Recently, several residents from the neighborhood community, along with some farm workers, reported GI symptoms including diarrhea, fever, and abdominal pain. Local healthcare providers noted a spike in similar cases over 2 weeks. Initial laboratory tests on patients revealed the presence of Salmonella enterica in stool samples. Public health authorities are concerned that the outbreak could be linked to Greenfield Farms, given its proximity and the interconnection between the farm, the community, and local food system. Key findings include medical investigations, which showed the local hospital admitted 15 patients with severe dehydration and GI symptoms. The majority of patients had consumed unpasteurized milk purchased from Greenfield Farms. Veterinary investigation shows that the farm's veterinarian reported that several cows exhibited signs of mastitis. A necropsy on a deceased chicken revealed lesions consistent with salmonella infection. Public health investigation showed inspectors found sampled water from a nearby stream for irrigation and identified salmonella contamination. Interviews with community members revealed that many households use the same stream for recreational activities. Finally, environmental concerns showed manure from the farm is applied as fertilizer to crops without prior treatment. Heavy rains last month caused runoff from the farm into the stream. Given our scenario, it's important to identify and map the possible pathways that this salmonella transmission disseminated into the community. So when we first look at it, we see contaminated food products, which include unpasteurized milk. Sick individuals consumed raw milk from cows with mastitis, a known contamination risk. A similar 2015 outbreak in California caused multiple illnesses as well. Secondly, we look at poultry products. Infected chickens may have contributed through contaminated eggs or meat, similar to the 2018 salmonella outbreak linked to raw turkey, which affected over 350 people. Next, we look at waterborne transmission. When we look at the irrigation system, a nearby stream used for irrigation tested positive for salmonella. Contaminated irrigation water also played a role in the 2006 E. coli outbreak in California spinach farms. Within waterborne transmission, we also have recreational and drinking water. Community members using the stream may have ingested contaminated water, echoing a 1998 outbreak in Ontario. Runoff contamination in Walkerton, Canada in 2000 caused widespread illnesses as well. Next, we look at the livestock. So farmers handling infected animals or manure may have contributed, as seen in a 2011 Florida agricultural worker outbreak. In addition, we have manure runoff. Heavy rain spread untreated manure into local water sources, similar to a 2013 outbreak in Germany. Finally, when we do interdisciplinary analysis, we look at direct contact with infected individuals. Infected individuals showing GI symptoms may have spread salmonella through poor hygiene, as seen in a 2016 daycare outbreak in South Carolina. Next, in our interdisciplinary analysis, we look at what the potential roles of humans, animals, and the environment are in this outbreak. They are all interconnected. So when we look at humans, we look at farm workers, which direct exposure to infected livestock such as cows and chickens likely played a significant role in the transmission of salmonella. Inadequate hand hygiene may have further contributed to the spread of the bacteria. In addition, we have local community members who may have consumed unpasteurized milk, contaminated poultry, or produce irrigated with infected water likely served as pathways for infection in the local population. In addition, we have healthcare and food handlers within local businesses. Improper food handling and poor infection control in healthcare settings can lead to secondary transmission, perpetuating the spread of salmonella. Next, we look at animals. Within animals, we have our dairy cows. So infected calves suffering from mastitis likely served as a primary source of salmonella contamination in raw milk. We also have poultry. Infected chickens could have contributed to the spread through both eggs and meat, leading to contamination of these products. Finally, we have local wildlife. Wild animals or domestic pets exposed to contaminated manure or water may act as reservoirs, further spreading the bacteria. Finally, we look at the environment. Water sources, the presence of contaminated stream used for irrigation and recreation, help facilitate the transmission of salmonella to both crops and people. Finally, we have manure management. The runoff of untreated manure, especially after heavy rainfall, likely contributed to the contamination of local water systems, affecting both agriculture and drinking water. To prevent future outbreaks, it is crucial to implement comprehensive control measures that address all of these factors. Next, when we're discussing this case, it's important to understand stakeholder engagement. So first, we talk about healthcare providers. Healthcare providers diagnose and treat affected individuals. They are usually the first line in understanding who's impacted by the latest outbreak. They document symptoms, perform diagnostic tests, and report cases to public health authorities to further investigation. We also have public health authorities who respond by testing food, water, and environmental sources for contamination, issuing health advisories, and working with other agencies to control and prevent future outbreaks. Next, we look at farm workers and management of reducing contamination risks. They must collaborate with investigators to halt the sale of unpasteurized milk, address any animal health issues, and improve waste management practices to minimize the spread of salmonella. Veterinarians play an essential role in diagnosing and treating livestock infections, especially focusing on mastitis in dairy cows and salmonella in poultry. They also provide disease control guidance to farm management. Next, we look at environmental and water authorities who are responsible for investigating water contamination resulting from farm runoff. They test local water sources to ensure safety for public use and monitor waste management and practices to prevent contamination. Regulatory agencies such as the FDA and USDA oversee food safety by ensuring farms comply with pasteurization and sanitation regulations, supporting product recalls when necessary. Finally, we have consumers, including local residents and schools, who must follow public health warnings, avoiding consuming raw milk, and promptly reporting symptoms to healthcare providers. Local government officials support public health efforts by facilitating communication with the community and ensuring access to healthcare services. Media outlets are also crucial for disseminating accurate information to the public, while retailers are responsible for removing affected products from shelves and maintaining food safety standards. Effective coordination among all of these stakeholders is essential for identifying the outbreak source, controlling its spread, and preventing future occurrences. Next, when discussing this case, it's important to form an action plan for mitigating the current outbreak. So immediate actions include product recall and public advisory. So Greenfield Farms must initiate an immediate recall of all unpasteurized milk and contaminated poultry products. The responsible parties are the Greenfield Farms Management, CDC, and World Health Organization. The timeline would be immediate action within the first 24 hours. Action steps include Greenfield Farms to identify and recall affected products, CDC and WHO to issue public advisory warnings of the risks of consuming unpasteurized milk and contaminated poultry, and public health campaigns should be launched to educate consumers on salmonella infection risks and proper food handling practices. In addition, for the immediate actions, we have healthcare and surveillance. So healthcare providers must prioritize the treatment of affected individuals, particularly those experiencing dehydration, GI symptoms, and septicemia. Responsible parties are hospitals, healthcare providers, and CDC. The timeline is ongoing with daily reporting. And of course, action steps include hospitals to allocate resources to care for infected individuals, healthcare providers to monitor for emerging complications and report of all new cases to public health authorities. And finally, strengthen surveillance systems to promptly identify additional cases and ensure quick responses. Next, for our action plan, we have farm hygiene and water quality control. So within this, we have veterinary and livestock management. Veterinary professionals are to inspect all livestock for salmonella infections and implement biosecurity measures. Responsible parties include farm management, veterinarians, and FAO. Immediate action should be taken within 48 hours. And action steps include conducting health checks on dairy, cows, and poultry, isolate infected animals to prevent disease transmission, and ensure regular veterinary oversight and implement enhanced biosecurity protocols. We also have water contamination control. So actions include suspend the use of contaminated water source, and the responsible parties are the EPA, Greenfield farms, and local authorities. Immediate action should be taken within 24 to 48 hours, which include shutting off contaminated water sources for both irrigation and recreational purposes, EPA to oversee water quality testing to ensure safety before reuse, and conducting further testing for salmonella and other harmful pathogens. Next, we have to talk about preventing future outbreaks. So firstly, we integrate surveillance and data sharing. Establish a comprehensive surveillance system integrating health, agriculture, and environmental sectors to track zoonotic diseases. Responsible parties are the CDC, WHO, FAO, and environmental agencies, and this would spend into the next 6 months. Actions include develop cross-sector data sharing protocols for real-time outbreak detection, and implement One Health surveillance framework to track and manage zoonotic diseases effectively. Next, we have improved farm practices. So that would include implementing enhanced manure management and regular disease surveillance on farms. Responsible parties are the farm management, veterinary teams, and FAO. This would be an ongoing with initial improvements within 3 months. Action steps include establishing manure treatment or composting processes to eliminate pathogens, prioritize vaccination programs for livestock against salmonella and other common diseases, and monitor farm practices to ensure compliance with biosecurity standards. Finally, we look at food safety regulations, which include enforcing stricter food safety regulations, including mandatory pasteurization and regular inspections of poultry processing facilities, which would be handled by the FDA, CDC, and local health departments. This would be immediate implementation with ongoing compliance checks, and actions would include increase the frequency of inspection at food processing facilities and mandate pasteurization of all milk and enforce regular safety audits of poultry production. Next, we look at public awareness and policy strengthening. So education and community outreach is a huge component of this, where you have launching public education campaigns on the risks of consuming raw milk and undercooked poultry, which would be headed by the CDC, local health departments, and public health organizations. This would be immediate and ongoing. They would develop and distribute public health messages about food safety, emphasizing proper cooking and handling techniques, along with engaging with local communities to promote awareness of salmonella risks. Finally, regulatory improvements, which includes advocating for stronger policies on farm waste management, food safety, and protections. Responsible parties are policymakers, environmental agencies, and agricultural organizations, where legislation would be put into place within the next 6 to 12 months. Action steps include pushing for stricter regulations regarding farm waste management and environmental safeguards, strengthening water safety regulations to ensure clean irrigation and recreational water sources. When reflecting on our One Health approach to Greenfield farms, we see that it provides a holistic, multidisciplinary response to the outbreak, addressing its root causes rather than just treating infections. Key benefits include holistic problem solving, where we tackle the spread of disease through contaminated livestock, water, and improper food handling, enhanced surveillance, which included collaborative efforts across sectors, facilitated timely tracking and early detection of outbreaks, improved prevention, public health education, and antibiotic stewardship, which encourages responsible antibiotic usage and explore alternative disease prevention strategies. Some challenges when using the One Health concept to this scenario was communication issues. Variations in terminology and priorities created challenges in coordinating efforts. Data integration, which includes developed standardized surveillance systems, required substantial investment and effort, regulatory conflict, and resource constraint. Finally, enhancing One Health understanding. This this enabled us to do cross-sector collaboration among medical, veterinary, and environmental professionals were essentials in managing the outbreak. It also helped us focus on prevention, improving farm hygiene, expanding vaccinations and education, impact of human activities, community engagement. Overall, by adopting One Health principles, Greenfield Farms can prevent future outbreaks, safeguard public health, and contribute to sustainable food system. Here we have some references. This is our last bit of references. Thank you so much for your time.